The nervous system is too delicate to bear anoxia for more than 3 minutes. The blood supply to nervous tissue per unit tissue is maximum in the body. It shows the importance of gray matter. The blood supply may be erratic due to hemorrhage, thrombosis, or embolism of the arteries supplying the nervous tissue. The arteries are end arteries as they enter the deeper level. Arteries of the brain. The brain is supplied by two vertebral and two internal carotid arteries, carry the total arterial blood supply of the brain. The vertebral artery is a branch of subclavian artery. The two vertebral arteries at the lower border of the pons join to form the basilar artery. The basilar artery lies in the basilar groove of the pons in cisterna pontis, supplies medulla, pons, and cerebellum, and at an upper border of the pons terminates by dividing into two posterior cerebral arteries. The internal carotid artery terminates by dividing into the anterior and middle cerebral arteries. The internal carotid arteries. They arise from the common carotid arteries and enter the middle fossa of the cranial cavity through the carotid canal, which opens into the side of the foramen lacerum above the closed inferior opening. It turns upward to reach the side of the body of the sphenoid bone. It then turns forward in the cavernous sinus to reach the medial aspect of the anterior clinoid process and lies lateral to the optic chiasma. Its course follows a series of bends known as carotid siphons. Here, in this diagram, you can see the internal carotid artery lying lateral to the optic chiasma, terminates here by dividing into anterior cerebral and middle cerebral. The two anterior cerebral arteries they communicate anteriorly here with the anterior communicating branch. Here you can see the basilar artery terminating at the upper border of the pons into two posterior cerebral arteries. The posterior cerebral arteries they are connected with the internal carotid artery through the posterior communicating branch. Here you can see the internal carotid artery lying in the floor of the cavernous sinus lateral to the sphenoid sinus. Here is the pituitary fossa where lies the pituitary gland. The branches of internal carotid artery it includes the hypophyseal arteries. They arise from the intercavernous section of the internal carotid to supply the neurohypophysis. They also form the pituitary portal system of vessels by which releasing factors are carried from the hypothalamus to the adenohypophysis. The ophthalmic artery it supplies the eye, the frontal area of the scalp, ethmoid and frontal sinuses, and dorsum of the nose. The posterior communicating artery joins the posterior cerebral artery, forming the circular village. Here you can see the circular village. This is the posterior communicating artery. This is the anterior choroid branch here given by the internal carotid artery. And here you can see the ophthalmic branch of the internal carotid. Here you can see the internal carotid and vertebrobasilar system and circle of Willis. Here is the two vertebral arteries joining to form the basilar artery, which are the upper border of the pons. Here joins divides into posterior cerebral arteries. The posterior cerebral arteries are connected with the posterior communicating branch with the internal carotid artery. Internal carotid artery terminates by dividing into anterior cerebral and the middle cerebral. Circulus arteriosus or circular face. It is a hexagonal arterial circle situated at the base of the brain in the interpedunculaire fossa. It is formed by anterior cerebral arteries and terminal parts of the internal carotid arteries with its posterior communicating branch and a posterior cerebral branch of basilar artery. The two anterior cerebral arteries are connected by the anterior communicating artery. The internal carotid arteries and the posterior cerebral arteries of the same side are united by posterior communicating artery. Formation of the circle of Willis. Anteriorly, it is formed by the anterior communicating artery joining the two anterior cerebral arteries. Anterolaterally, it is formed by anterior cerebral arteries. Laterally, it is formed by the internal carotid artery. Posterolaterally, it is formed by the posterior communicating arteries. Posteriorly, it is formed by posterior cerebral artery. The circulus arteriosus attempts to equalize the flow of the blood to the different parts of the brain and provides collateral circulation in the event of obstruction to one of its components. There is hardly any mixing of the blood streams on the right or left side of the circulus arteriosus. The middle cerebral artery is not forming the circle of Willis. So this is very important. Middle cerebral artery is not a part of circle of Willis. Here you can see the hexagonal circle of Willis anteriorly formed by the anterior communicating. Anterolaterally here it is formed by the anterior cerebral artery, laterally by the internal carotid, posteriorly here by the posterior communicating, and posteriorly you can see it is formed by the posterior cerebral artery. Branches of the circle of Willis. The branches of the circulus arteriosus are cortical, central, and choroidal. The cortical branches. The cortical are the external branches run on the surface of the cerebrum anastomose freely, and if they get blocked, they give rise to small infarcts of the cortical tissue of the cerebrum. These branches arise from all the three cerebral arteries. Anterior cerebral artery, it is the smaller terminal branch of internal carotid artery, coextensive with the corpus callosum. The two arteries are connected by the anterior communicating artery. Its cortical branches are orbital, frontal, and parietal. Middle cerebral artery. It is the largest and direct branch of the internal carotid artery. It runs in the lateral sulcus and lies on insula. Its cortical branches are orbital, frontal, parietal, and temporal. The posterior cerebral artery. The It is the terminal branch of the basilar artery. It winds round the cerebral peduncle to reach the tentorial surface of the cerebrum. Its cortical branches are temporal, occipital, and parieto-occipital. Then central branches. The central branches of the cerebral arteries, they perforate the middle and perforate the white matter to supply the thalamus, corpus stratum, and the internal. So this is the central branches. They are very very important because the central branches, they perforate the white matter to supply the thalamus, corpus callosum, and the internal capsule. These branches do not anastomose, and if these get blocked, they give rise to large infarcts. These arteries are thin, numerous, and end arteries, arising in six groups. Anteromedial group, it arises from the anterior cerebral and anterior communicating arteries. These enter the medial most part of the anterior perforated substance to supply the preoptic and supraoptic regions of the hypothalamus. Number two, anterolateral group. This arises from middle cerebral, divided into two subgroups, that is a medial strate and lateral strate. Medial strate ascend from through the lentiform nucleus to supply this nucleus, including caudate nucleus and internal capsule. The lateral strate arises arteries. The lateral strate arteries run lateral to the lentiform nucleus. They turn medially to enter internal capsule. One of the lateral strate branches is larger than others, and it is known as Charcot's artery of cerebral hemorrhage. Here in this diagram, you can see bran- the central branches from the anterior cerebral, from the middle cerebral, from the internal carotid, from the anterior choroidal, and from the posterior cerebral. They supply the area of the caudate nucleus, thalamus, internal capsule. And this is very, very important because here in the internal capsule, the most of the tracks, ascending and descending tracks, they are very close together. They are in compact position. So if there is the involvement of these arteries, the lesion is very large. Then the posterior medial group. It arises from the posterior communicating and posterior cerebral arteries. They supply tubuloinfundibular and mammary regions of the hypothalamus, subthalamus, anterior and the medial parts of the thalamus, medial part of the tegmentum, and crest cerebri of the midbrain. The posterolateral group, this arises from the posterior cerebral artery. They supply caudal part of the thalamus. Then choroidal branches. There are three choroidal branches: anterior, posterior, and posterior inferior cerebral artery. The anterior choroidal is a branch of internal carotid artery. It supplies blood to the choroid plexus of inferior horn of the lateral ventricle. The posterior choroidal artery arises from the posterior cerebral artery. It gives branches of the lateral and the third ventricle. The posterior inferior cerebral artery it supplies the choroid plexus of fourth ventricle. So that the choroid plexus of lateral ventricle and third ventricle, it is supplied by anterior choroidal and posterior choroidal artery. The fourth ventricle, choroid plexus of the fourth ventricle is supplied by the posterior inferior cerebral artery. Then the arterial supply of different areas of the cerebrum. The cerebral cortex is supplied by branches from all the three cerebral arteries. The superior surface is supplied chiefly by middle cerebral artery. A strip of about 2 centimeters long the, along the superior medial border from the anterior pole to the parieto-occipital sulcus is supplied by anterior cerebral artery. The inferior temporal gyrus, except temporal pole, is supplied by posterior cerebral artery. The area of the occipital pole is supplied by the posterior cerebral artery. In this diagram, you can see the superolateral surface of the cerebrum. Most of the area is supplied here by the middle cerebral artery. A strip along the superior border, about 2 centimeters long, superior middle borders. This is supplied by the anterior cerebral artery, the cortical branches of anterior cerebral artery. The area posterior to the parieto-occipital sulcus is supplied by the posterior cerebral artery. Is also posterior cerebral artery also supplies the occipital pole and the inferior temporal gyrus. In the medial and tentorial surfaces, the main on this surface is anterior cerebral artery. The medial surfaces of the occipital lobe, temporal lobe, except area around the temporal pole, is supplied by posterior cerebral artery. Temporal pole area is supplied by middle cerebral artery. In this diagram of the medial and the infratemporal surface of the cerebrum, you can see the main artery supplying the medial surface is the anterior cerebral artery running along the corpus callosum. This is the corpus callosum, and this anterior cerebral artery runs along this corpus callosum. Here, behind the parieto-occipital sulcus, this area here, you can see it is supplied by the posterior cerebral artery. It is the area of the occipital lobe, the inferior temporal gyrus. Here, this area of the temporal pole is supplied by the middle cerebral artery. Inferior surface. Medial one-third of the orbital surface is supplied by the anterior cerebral artery. Lateral two-thirds, including the temporal pole area and the anterior-most part of the tentorial surface, is supplied by middle cerebral artery. The rest of the tentorial surface area is supplied by posterior cerebral artery. In this diagram, you can see here this area of the orbital surface medial area. This is supplied by the anterior cerebral artery. The lateral part of the orbital surface, it is supplied by the middle cerebral artery, and rest of this area here you can see it is supplied by posterior cerebral artery. Middle cerebral artery you can see also supplied to the temporal. So Middle cerebral artery supplies the lateral part of the orbital surface and the temporal pole. Blood supply of the cerebellum. The cerebellum is supplied by superior cerebral artery, the anterior inferior cerebral artery, and posterior inferior cerebral artery. Here you can see the blood supply of the cerebellum. The Here you can see the superior cerebral artery. This is the anterior inferior cerebral artery, and here is the posterior inferior cerebral artery. The superior and anterior inferior cerebral arteries, they are the branches of basilar artery. So these two are the branches of basilar artery, and the posterior inferior cerebral artery here. This is a branch of vertebral artery. Then coming to the blood-brain barrier. The existence of a blood-brain barrier or the hematoencephalic barrier is due to the fact that the endothelial cells of the brain capillaries are held to each other by tight junction. The blood-brain barrier is formed by structures between the blood and the nerve cells of the brain. These structures consist of capillary endothelium, number two, the basement membrane of the endothelium, and number three, the intimately applied to the capillaries are numerous processes of the astrocytes, and it has been estimated that these processes cover about 80% of the capillary surface. Some areas of the brain are devoid of blood-brain barrier. These areas include pineal body, the hypophysis cerebri, the choroid plexus, and the area proxima of the fourth ventricle. So, in these areas, that is the pineal body, the hypophysis cerebri, the choroid plexus, and the area proxima of the fourth ventricle, the blood-brain barrier is absent. The blood-brain barrier exists in newborn, but it is more permeable to certain substances than in the adults. In this diagram, you can see how the blood-brain barrier is formed. This is the, you can see the capillary epithelium. This is, you can see the endothelial cells. Here you can see the basement membrane, and here you can see the astrocytes that are tightly attached to each other. The functions of the blood-brain barrier. Number one, to modulate the entry of the metabolic substances, notably glucose. Number two, to allow entry of gases, water, electrolytes, amino acids, and water-soluble substances. It limits the entry of the macromolecules, that is, lipid soluble substances, and thus it blocks the entry of toxins as these are bound to plasma albumin or their solubilities are inappropriate. This blood-brain barrier blocks the entry of transmitters from the blood, notably epinephrine. The drugs like penicillin, noradrenaline, and thiopentane cannot cross the blood-brain barrier. Some drugs like atropine, chloramphenicol, tetracycline, and sulfos they cross the blood-brain barrier easily. Its other important function is to pump ions, notably the potassium, into and out of the blood. The entry of the hormones is restricted to certain places only so that the normal biological rhythm of the body is maintained. Then perivascular spaces. The perivascular spaces, also known as Virchow-Robin spaces, these are the extensions of subarachnoid space around blood vessels penetrating the brain surface. The spaces taper progressively, although these spaces are inward extension in the anatomical sense. The subarachnoid and perivascular spaces are separated by thin layer of diameter. The flow of the extracellular fluid is outward in the subarachnoid space. Here, you can in this diagram you can see the perivascular space. Here you can see the funnel formed by between the diameter of, around the blood vessel and, and here the diameter around the cortical surface or the brain tissue. So this funnel here you can see, and this fuses finally here the two layers of the diameter, one around the blood vessel and another around the cortical pia, around the nervous tissue. They finally fuse, tapered up. So this is the perivascular space. These perivascular spaces are involved in autoregulation of brain arterioles, which regulate the blood supply of brain tissues. The chief internal source of the autoregulation is the adjustment of arterial muscle tone in response to intraluminal pressure changes. The cerebral blood flow remains at 60 to 70 ml per gram per minute during systemic blood pressure. The changes in the blood pressure may be from 80 to 180 mmHg. So, if the systemic blood pressure is from 80 to 180 mm mercury, the cerebral blood flow remains at the level of 60 to 70 ml per gram per minute. This is achieved by direct myogenic response to distension produced by rising intraluminal pressure. The H ion concentration in the perivascular space is the chief external source of autoregulation of cerebral blood vessels. A rising H ion concentration that is usually following hypercapnia, excess plasma CO2 level, travels along the perivascular space from the capillary bed and then it inhibits the vascular muscles, perhaps by reducing the ionized calcium level. On the other hand, hypocapnia causes vasoconstriction. Clinical anatomy. The thrombosis of the lateral striate branches of the middle cerebral artery causes motor and sensory loss to most of the opposite body except lower limb. Hemiplegia is a common condition. It is an upper motor neuron type of paralysis of one half of the body, including the face. It is usually due to an internal capsule lesion caused by thrombosis of one of the lenticulostriate branches of the middle cerebral artery, commonly known as cerebral thrombosis. One of the lenticular branches is most frequently ruptured, that is condition known as cerebral hemorrhage, and this artery is known as Charcot's artery of cerebral hemorrhage. This lesion also produces hemiplegia with deep coma, and it is ultimately fatal. The thrombosis of Hebner's recurrent branch of the anterior cerebral artery causes contralateral upper monoplegia. The occlusion of the anterior cerebral artery proximal to the anterior communicating artery is normally well tolerated because of the cross flow from right to left or left to right. Distal occlusion of anterior cerebral artery results in weakness and cortical sensory loss in contralateral lower limb with associated incontinence. This artery supplies area of lower limb and perineum. The thrombosis of the paracentral artery, that is a terminal cortical branch of the anterior cerebral artery, causes contralateral lower limb monoplegia. So this is all about the blood supply of the brain, the blood-brain barrier, the perivascular space, and the clinical